This video covers first aid for bones, joints, head, and spinal injuries, as well as how to respond to electrocution. We'll explore R.I.C.E, how to manage suspected fractures, splinting techniques, and how to spot concussions and manage potential spinal injuries. For sprains and strains, use the R.I.C.E method for the first 48 hours. Rest the joint. Apply ice wrapped in cloth for 15 to 20 minutes, compress with an elastic bandage, and elevate the limb above the heart to limit swelling. Seek professional care if there is severe pain or inability to bear weight. Treat an injury as a fracture if you notice deformity, grinding, or heard a snap. Other signs include inability to move or bear weight, or rapid swelling and bruising on the bone. If you are ever unsure, always assume it's a fracture and immobilize the area until an X-ray can be taken. When splinting, do not attempt to straighten the limb. Splint it in the position you found it. Immobilize the joints both above and below the injury, using rigid materials with padding. Tie the support firmly, but not so tight that it cuts off circulation, and recheck every few minutes. An open fracture where bone breaks through the skin is a surgical emergency. Call 911 immediately. Control bleeding by applying pressure beside the wound, never directly on the exposed bone. Cover with a moist, sterile dressing, then splint as found, and treat the patient for shock. If a joint looks wrong or won't move, it may be dislocated. Never attempt to put it back yourself, as you could cause severe nerve or vessel damage. Instead, splint or sling the limb in the position it was found, apply ice for pain, and seek prompt medical care. After any blow to the head, watch for concussion signs like headache, confusion, or nausea. Seek immediate emergency care for red flags like unequal pupils, seizures, or worsening symptoms. Behavior changes, such as irritability or memory gaps, are also important to note during the first 24 to 48 hours. Concussion care has evolved. After a medical assessment rules out danger, it is perfectly fine for the patient to sleep. They should engage in relative rest for 24 to 48 hours, avoiding screens and sports until symptoms ease. A gradual, supervised return is essential to prevent repeat injury. Suspect a spinal injury following falls, diving, or serious crashes if there is neck or back pain, weakness, or numbness. Keep the head and neck perfectly still by holding it manually. If CPR is required, use a jaw thrust maneuver to open the airway without tilting the neck. Only move someone with a suspected spinal injury if there is a greater danger, such as fire or traffic. If movement is necessary, use multiple people to keep the spine in a straight line. One person should lead to coordinate the movement, keeping the head, neck, and shoulders as one unit. For electrical injuries, never touch a person who is still energized. First, disconnect the power source. Lightning victims are generally safe to touch immediately. If the person is not breathing, start CPR right away. Always have them medically checked, as burns can hide serious internal damage. To summarize the quick rules, do splint limbs in the position found, immobilize joints, and keep a suspected spine injury still. Avoid straightening limbs, pushing bones back, or rushing a return to sport. Safety and professional assessment are your priorities. Remember these three main points. Splint injuries exactly as you find them. It is okay for a patient to sleep after a concussion assessment, and never move someone with a suspected spinal injury unless they are in immediate danger.